So when we talk about evaluating back pain and dysfunction, oftentimes I think we just focus in on the pain and not really associate any clinical relevance to maybe muscle atrophy or weakness or poor motor control. I think we're going to talk a little bit more about some of those issues there. But I think in general what people are doing is just going down the back, pushing here and saying, well, does he have some muscle soreness here or spinous process pain here? And again, forgetting about 80 to 90% of the trunk and focusing just on the dorsal aspect. Again, that's frustrating because some of the vague clinical signs, you get 10 different horses with back problems, you probably have 10 different clinical signs you're looking for. I think it's unfortunate that we don't use diagnostic analgesia much in the axial skeleton, especially related to osteoarthritis or impinged spinous processes. I think we need to do that more. We're developing more objective measures with that. They obviously need to be validated, and so that's some of the challenges with that. Some of our technologic limitations with our diagnostic imaging, there's just a big mass there, and oftentimes you can see the dorsal aspect of the spinous processes, but what about the articular processes? What about the vertebral bodies? What about the soft tissues? And so with that, then we oftentimes have some sort of a disconnect between clinical signs, diagnostic imaging, pathologic reports. We need a lot more epidemiologic studies to correlate or to assess what's the clinical relevance of all of those to do that. And so I think we have a lot of work to do in this area.